All right. Sounds like y'all are having some robust discussions. I love it. I love it. I love it. Thank you so much for engaging in these small groups. Oh, look at that. You're thanking them for their emotional labor that they invested. I love it.
We're twins.
I mean, people think we are.
Yes, we've been mistaken for each other several times
We're
here.
each other's doppelgangers.
Mhm.
Yeah.
So, at least in our discussion, I think, there were some kind of perspectives that don't all exist at the same time, but I think they're great points. And the purpose of this is to look at each patient interaction, or more specifically, each bedside ultrasound as just a crossroads, where we can either have a healing event, a neutral event, or a re-traumatizing event.
Do we want to ask one takeaway from each group? What's one thing that you're going to walk out of this room with and start using?
Well, I was trained a long time ago, but I have never thrown or politely thrown out any family members from the room when I began the ultrasound, because I've always assumed that these were intimate contacts of the patient and that they were kind of, vested in the workup. So I've never asked them to leave.
Mm-hmm.
And from our discussion, at the very least, there is perhaps some scripting or some subtle ways to feel out the need of the patient
Mm-hmm.
and provide a way for the other member or the other person in the room to leave without any insult
Mm-hmm.
being taken.
Thank you. What about this group over here? Mike.
You are very loud, though, and I appreciate that.
She's projecting, but we want to get it in the recording. It's important.
I think the big thing that I'm going to take away is taking every opportunity you can to give your patients an opportunity to express a choice, and being intentional about asking them what they would like to do instead of assuming that they're just cool with going along with your plan.
Great. Thank you. And our last group, one takeaway.
I think the one I would say is similar to everything else, getting good dot phrases is working on that scripting ahead of time. So when you have a patient encounter, just being able to set the stage, set the parameters, both with your team as well as the patient of what to expect, and setting those expectations so that it'll go much better and you're not kind of shooting from the hip.
Thank you.
Thank you. So, in closing, your bedside ultrasound can include a whole lot of reflections, and where to start. I hope that this can kind of gives you a framework just to start with. And we're busy ER doctors, and I think all I ask is that as we move forward, we reflect on just one way that we can change our bedside ultrasound. And I just want to bring this up in closing, is that one way that I think I want to make sure that I don't forget is my nonverbal communications. We didn't even really get a chance to talk about it, but those are always running at the bedside, especially in bedside ultrasound. And so, at the very least, what is your fast positive face? And how do you communicate at the bedside? Thank you.
Thank you.